So yes, it's great to see everyone again. I just go over one ground rule before we begin. Please keep your mic mute on during all times during this lecture. And if you have any questions during the duration of the lecture, please feel free to put them in the chat box below, and we shall address them at the end of the session. So there's something extremely dashing and glamorous about the idea of surgery. Uh, for the layman or even the uninitiated medical students such as myself, it conjures up images of sterile white OTs with beeping and buzzing machines, in the midst of which there's this one figure standing, focused, hard at work, reaching out for complicated looking instruments now and again. And as an audience, we just inherently know the procedure is nothing short of a medical miracle, the one that we're witnessing. But surgeries weren't always like this. Before the advent of anesthesia and antiseptics, the prospect of a surgical operation was a terrifying ordeal. Join us today as we trace the origins of surgery in our lecture by Dr. Avinash Supe, sir. Dr. Supe describes himself as a KEMite through and through, having started as an undergraduate student here, eventually becoming the dean of this esteemed institution, and now an emeritus professor of GI surgery. He has also been the dean of LTMMC and the director ME&MH. Dr. Supe is deeply involved in medical education and has won the prestigious Dr. B.C. Roy National Award. It is an honor to have sir here today to talk about the history of surgery. Thank you so much for accepting our invitation, sir.
Thank you, Rahul. I think, can I share my screen actually?
Yes, sir. Should be able to.
Okay. Are you able to see my screen?
Yes, sir.
Okay. Are you able to see my full slides?
Yes, sir.
Okay. So thank you so much, Rahul, for actually I would like to appreciate and thank you, Rahul, especially Lopa Madam and Pandya sir for this wonderful series of history of medicine, and especially to asking me to talk on this particular topic. I have no conflict of interest to declare, but I would like to say that, like Dr. Pandya had also said last week, history of surgery is too vast. I have just picked up few landmarks which I thought very important, and I would like to share with them. And history of surgery, I have also looked at Harold Illis's book, other many books and websites. Are you able to see my slides moving, Rahul?
Yes, sir.
Okay. Now, I think Siddharth Mukherjee in his Emperor of Melodies said that if the history of medicine is told through the stories of doctors, it is because of their contributions stand in the place of more substantive heroism of their patients. And of course, I think this is a wonderful quote. Now, Lord Moynihan also said that surgery in the days to come will be advanced by men and of course women, trained in the methods and imbued into the spirit of experimental research, though it will no doubt continue to be practiced to their profit by those who are merely craftsmen. Now, all of you know that the word surgery came from Greek word that is shear means hand and ergon is to work, and also from the Latin word chirurgia that also means hands, art of hands. So it's a treatment of disease, injury or deformity which is done by either manual or instrumental operations. Now, I'm sure animals and humans were injured many thousand years ago also. Either there were arrows or some kind of injuries. And if you see around in the world, such pictures were already there many years ago if you look at the excavations. The craft of surgery is as old as mankind. And this is what all of us should understand. Of course, it has changed over years. Now, I think I was amazed with this word Amazon, Amazia. Amazon comes from Amazians. That means removal of one breast for archery. That was the woman they were doing. You know, I think this was something, if you really see, one breast of this lady is removed especially for archery. Of course, if you go to Wikipedia, there are a lot of controversies about this. But the word Amazon appears to have come from Amazians, from those locals whose breasts were removed at the time for archery. That means. Now, if you look at the first record, trephination of skull in ancient Peru, somewhere around 10,000 BC, and you look at the kind of squares they have made into the skull, and trepanned skull from the ancient Peru, and the operation has been performed by means of series of incisions placed at right angles to each other. I think they found similar skulls in Egypt, France, and many other countries. So there must have been some communication many years ago. But I think if you look at the Egyptian physician, I don't know how do you call it, but it's Imhotep and papyrus. I think both these, I think, was need to look at the kind of narratives they had really written. And if you see the tomb carvings in Egypt, there's a carving of circumcision in somewhere in 2500 BC. Look at pictures how the circumcisions were done. You know, when I was studying for my postgraduate examination of MS in our library, postgraduate library, there was a wonderful book on Masai Mara. And Masai, if they see, there was a full chapter on circumcision, which I was amused at that time, that how a young male is circumcised and how this is more often, that time it's a festival. And there's a Masai circumcision after party, especially those wearing who is a red. So circumcisions have been done for many years, it has been done. Now, if you look at many years ago, 2450 BC, there have been fractured forearms which were treated with bark splints from Egyptian excavation. And if you look at them, there was a first blood-scented lint, and this is from the Howard University. So if you look at even the other kinds of pictures from ancient textbook of surgery, look at the kind of arrows and which have been really there. And even you look at the gynecological papyrus, treat women's complaint. But there were wonderful writings from the papyrus. If you examine a man having a dislocation of his mandible, should you find his mouth open and his mouth cannot close again, you should put your two thumbs upon the ends of the two rami of the mandible inside his mouth and your fingers under his chin, and you should cause them to fall back. Now, the kind of reduction of the submandibular joint dislocation they have really said is quite, I think, very well written somewhere in 2000, 2500 BC. This was something which I came very interestingly, the king of Hammurabi. And I thought this was something which was interesting, which was a code of King Hammurabi. If a doctor heals a free man's broken limb and has healed his sprayed tendon, the patient is to pay doctor 5 shekels. If he's a nobleman, he has to give 3 shekels of silver. If physician has healed man's eye of severe wound employing a bronze instrument, healed the man's eye, he has to pay 10 shekels to silver. But look at the other part. If the doctor makes a mistake and somebody loses his eye, his hands are cut off. I think this is worse than the Consumer Protection Act. If you look at China sometime, this was the kind of a scene. The draining of an abscess of a person, which was done, a General Kuan Yin, who shows his indifference to pain by playing a board of game, because that time there was no anesthesia. So somebody is trying to drain an abscess and he's trying to play board of chain just to distract himself. So I think the things were very different during that time. Now let's come to India somewhere around 530 to 600 BC when Shushruta was there. And all of us know Shushruta was the father of surgery in India, definitely, and Shushruta stressed following requirements of a student. Now he said that they should be in tender years, born in a good family, possesses a desire to learn, have strength, energy of action, contentment, character, so many things he wrote about that. He should have clear insight of things, straight nose, honest. I'm sure the kind of parameters he had said were far different from NEET parameters. Even today, it would be difficult to find a medical students who are at such paragon of virtue. But I think the whole science of medicine in India starts with Atharva Ved, the sacred text of Hinduism. And they were used to use a lot of herbs and herb elements to treat, especially if you look at Charak Sanhita. But look at the surgical aspect of it. Look at the way they used to use ants to close wounds. And I think this was a wonderful way and innovative way. The kind of instruments Shushruta had, the rhinoplasty I will talk about. He also talked about simulation, suturing of animal skins or strips of cotton, improving the bandaging on life-size dolls. Today what we really use this. Practice incisions on watermelons and cucumbers. Cauterize a piece of meat before trying his method on his patients. And of course, ligature of blood vessels, bloodletting of lotus stems. Now, I think this is something which was very interesting, and that time the course of surgery was 6 years. And if you look at the once, I think I had to write one article on Sushruta and his instruments. So I really went into depth that time, and I found out that so many instruments are so close to our current instruments, whether it's a ENT, whether it's a surgery, whether it's a suturing. If you go through that detail, there was a lot of basic principles of ergonomics, as well as the kind of structure was there in those instruments, which was fairly well thought, I thought so. In fact, the rhinoplasty and cataract were there, and Britishers used Indian concepts in 1860 and refined them over with the use of anesthesia. If you talk about Greek medicine, somewhere around 400 BC, look at the way they have written bandaging. It should be done quickly, without pain, with ease and with elegance. Quickly by dispatching the work, without pain by being readily done. With ease by being prepared for everything, and with elegance so that it may be agreeable to the sight. Very nice. I mean, it should look nice. It should do its job. It should not have pain. Wonderfully written at that time. In fact, if you look at the Greek and Roman medicine, they are the ones who describe the 5 cardinal signs of inflammation, swelling and all that kind of thing. And you look at the kind of Roman instruments. They were also very good in terms of like forceps, scissors, and these were wonderfully shown the way they are trying to treat a dislocated shoulder. In fact, if you look at Hippocrates and his description in a Greek medicine, look at the picture on which they used to really reduce the dislocated shoulder. The one man is pulling, other man is putting a cloth and putting the same kind of a thing which was done many years ago also, but without anesthesia. And I think this was a way the principles were developed. They had a much better understanding, I think so, at that time. Now, I think all of you know the story of Prometheus and liver. Prometheus was punished by supreme god Zeus for giving to mankind the Olympic fire, with which they learned to think and feel. So everybody was angry with him. He was changed to a cliff, and then he was matters worse. He was visited by an eagle who ate part of his liver. At that night, every night, however, his liver grew back. We now know that the liver can regenerate. But were the ancient Greeks aware of this quality? We really don't know, but at least it's wonderful to see how they have really depicted in this picture. Then came the Romans, which the surgeons attending Roman legionaries, Gallon, especially if you really see. And this is John of Ardini, somewhere as an English surgeon. He was removing sword from the thigh. Look at the way he's trying to remove sword. And he's operating on a fistula in ano. I'm sure the kind of, look at this picture of John Ardini and look at the illustration of fistula in ano and the surgical instruments used in its surgery. And these are all complex fistulas with multiple holes. And look at the kind of connections he has made, the kind of instruments he had. So I think it just tells you that they were also trying to work on complex surgeries, and they had so much of self-developed kind of things, in spite of having many other things like anatomy and were not really known to them so much. But I'm sure they had understanding and they were doing all this complex work. This is Theodoric. The Theodor means gift of God. And if you really see many names like Theodore, Cocker, and I'm sure there are many names we continue to Bilroth and all that kind of things. But if you look at this picture, they are trying to show examination of breast and rectum, how it was done. And at that time, I think somebody's holding, he's turning on the his side, and then somebody's trying to do examination. Then came somewhere, I think, the age of surgeon anatomist. And I think if you see, they started dissecting the dead bodies, and cadavers were dissected at that time. And look at the way there is a body which is there. There are many people watching it, and they are trying to dissect in an anatomy hall. And typical pictures of very high wall, and everybody's watching, and they started dissecting the body. And if you look at those pictures, they were trying to look at every muscle like sartorius, and they were started looking at all these muscles, biceps and I think the way they have been trying to dissect out all muscles and vessels, that is the way the anatomy started really working. And I think Ambrose Paré is something which made a lot of contribution as a surgeon anatomist. He had a lot of contribution to congenital hernia, ligature, wound management and antisepsis. In fact, I visited his hospital in Lausanne where he had some time work. He used tourniquet to stop bleeding from the wounds. And that's a very classical, and that time they used to do amputations, especially, and use ligature to stop bleeding from the vessels. And he used to say, I dressed the wound and the God healed him. And that was and it was a method of curing wounds. And that was made by the gunshot. I mean, this is something that time mainly the surgeons were there for the wound and military kind of wounds. Now, his father was a barber to the local squire, and Paris' sister married to a barber surgeon who practiced in Paris. And his elder brother was a master barber in Vitré. So the whole family of barber surgeons. And they started as barber surgeons. Soon he became something like a houseman. And then he became a military surgeon to rose to the colonel level. And he was the one who tried many things. He applied something like digestive of egg yolk, rose oil, and turpentine. And wound healed well instead of hot oil. Now, in fact, barber surgeons became a big kind of a movement in all over the UK or Europe. In fact, you look at the Henry VIII presents the charter to the Company of Barber Surgeons. You can see the Henry VIII standing here, and there are many people who are standing next to him. And barber surgeons were medical practitioners in medieval Europe. Unlike many doctors of the time, performed surgery often of the war wounded. And barber surgeons would normally learn their trades as apprentice to more experienced colleagues. And it was one-to-one kind of a training which went. In fact, that time military and military wounded were the common thing. Use of gunpowder in war field and surgery was entertained for the sake of soldiers. And if you look at these camps which are there on the military on the front, and you can see all these kind of their weapons, and somebody is trying to treat at the end, and somebody is trying to do on the grass, and that kind of surgeons were doing. In fact, you can see the lectures were also given on to the barber surgeons in a barber surgeons hall, and this was all into UK. Now, William Harvey was also one of them who developed ingenious demonstration of the functions of the venous walls using superficial veins of the arms. Look at his picture. He's trying to do like what test we do for the varicose veins. And it was very interesting. He's trying to look at the flow of those vessels, how it is really going. Same way, the Heister's walls, we normally look at the Heister's walls and all this. So he was the one who created this anatomical cases observations. It's called as medical, chirurgical, and anatomical cases. And that was a kind of a book which came sometime around 1700. Now, use of ghee was used for wounds. This was very common, and even in India it was common. Ayurvedic literature always documented it. Shushruta also documented it, combination of a ghee and honey. In fact, if you listen to the stories of Chhatrapati Shivaji Maharaj during 1600 times, they had on their forts wells of ghee, which was destroyed. I mean, some kind of kuzlela tup mantat na tala, which is really, I think, that was commonly used for wounds. And they used to have a synergistic healing effect on them. At the same time, in Europe, there was a Percival Potts, which is known for Potts spine and Potts fracture really came. And of course, John Hunter, Hunterian Canal and Hunterian Museum, which is very well known, that was during that time. But I think we must remember Sir Ashley Cooper, the Cooper's ligament, and he was the one who started ligating aorta in a man. And this is from, again, St. Thomas's Hospital. And she is a very dynamic person who contributed immensely into the surgery. Now, after this, there were important developments that helped surgery to advance. And these were 5 major developments. One was anesthesia. Second was antisepsis. Third was nursing. Fourth was development of hospitals and operation theaters. And fifth was blood grouping and transfusions. So I'll go one by one and say how it really changed the way we do surgery. Now, anesthesia, I think William Morton, an American dentist and physician, tested ether as anesthetic in animals and then his patients. He was the first who demonstrated this method, and Dr. Warren removed the tumor from the patient's neck without any distress. This was the first case they did it somewhere in 1846, and that was the way general anesthesia came into clinical practice. In fact, they celebrated this in the middle of the 19th century, that painting of the first operation under ether, and Morton holds his anesthetic apparatus. Look at this apparatus, how he had a very basic apparatus he was doing, and he was giving these kind of anesthesias. So the word anesthesia was suggested by Holmes, and he was a professor of anatomy and physiology in Harvard Medical School. He did so in November 1846, few weeks after the first use of ether. Till the time it was known as etherization. And I think then the anesthesia was a word which was passed into the English language. Although, I mean, and then you really find the word anesthesia appeared into English dictionary. And look at this, Professor Simpson, James Simpson. He had a simple rag bottle method of administration of chloroform used by Simpson. Now, if you go through this, these are so innovative people who have developed all this, and they have tried to understand physiology in those days and then try to do a lot of experimentation to come such kind of a process. Now, very interestingly, if you see William Halsted, I think all of us should really respect him tremendously. He was in New York, then he went to Johns Hopkins. Everybody knows he went to Baltimore. He was the one who was advocate of local and regional anesthesia. And he used drug cocaine so much that he himself got addicted to this. His 3 colleagues died. Halsted himself required hospital admission for psychiatric care. And in lifetime, he could not come out of the morphine addiction. And that was because, this is because of local and regional anesthesia. In fact, simultaneously, Louis Pasteur worked in Paris, and he was later appointed as professor of chemistry. And Pasteur was able to show that broth sterilized by boiling would remain so in a placed of flask plugged by the sterilized cotton wool, which would allow access to atmospheric air, but not to organisms in air, which would be filtered. So this was the era where the antisepsis started coming up in picture. So in fact, if you look at the Joseph Lister and look at the way he used to treat patients, he used to use undiluted carbolic acid. Imagine, it must be very painful for the patient. And he used to put it by a lint, and he used to cover it with a sheet of tin foil. And these are his original pictures from the Glasgow Royal Infirmary. And he dressed the wound again. He was an 11-year-old child with a compound fracture, James Greenell's what they call it. And he used to put them, it all became a protective crust. And beneath the miracles of miracles, the wound began to heal. And kept him untouched for 5 days. The patient remained uncomfortable. Imagine the patients were probably able to, the pain of the fracture versus pain of this particular kind of a dressing. And he walked out of that Royal Infirmary, Glasgow, after 6 weeks. So that was the first understanding of antisepsis. So then came the era of aseptic surgery. And if you look at this picture in 1893, only the surgeon is wearing rubber gloves. His assistants are barehanded. And this is something where it was not so probably easy to get. And all of us, I remember, even till 1986, till HIV, all this came, small procedures we used to do barehanded. We never had so many rubber gloves. When after 86, when HIV scare come, we all started using. Now, in fact, antibiotics is something which really brought, I know everybody knows that Alexander Fleming, who found out the penicillin, and then along with his 2 friends, Florey and Chen, they shared a Nobel Prize. And of course, this opened up the whole antibiotics and was helpful, especially into the Second World War, to reduce the mortality. In fact, Semmelweis is a Hungarian physician who was also early pioneer of the antiseptic procedures. And he was the one who reduced the maternal mortality by reducing the purpular fever. And then he started washing how they were doing the umbilical cord and all this he started really doing in Vienna. Now, I'm sure everybody should remember the story of Halsted and Hampton. And all of us know that William Halsted, a professor of surgery at the Johns Hopkins Hospital, Baltimore, was most disturbed when in 1889 his theater sister, Miss Caroline, said that she's going back. She's going to retire because she could not long tolerate intense irritation of her hands produced by constantly digging them into antiseptic solution, which was a corrosive sublimate. So Halsted went into the Goodyear Rubber Company, which is a tire company, and brought them back gloves for Miss Hampton to use. Her skin irritation disappeared, and that was the way Operation Theatre got gloves. And the best part was The ending of the Halstead-Hampton story is a romantic one, as following year they got married. So actually, we must thank Halstead and Hampton because their romantic gesture helped bring glows to the operating room. See, I think it's very interesting to see how the relationship and the passion and is for the had made him go to a tire company and glows to see that an allergic reaction is less. And this was somewhere in 1904. Then another advance which came was about blood grouping and transfusions. I think this all happened in Vienna and then all over the world. And you find blood transfusion saved lakhs of lives in world wars because it was in the First World War and Second World War. And this was just before the First World War. And then he also received a Nobel Prize for the same. Another advancement which came somewhere in the same time around 19th century second half, that is 1873, people started developing surgical instruments. And look at this atlas of surgical instruments. And these were kind of cases where people started doing. Now, this was a time people started thinking about technology. Till the time people were using simple instruments. This was the time people started using selling instruments. At the same time, you started developing operation theaters like this. These were not fully sterile, but there was some amount of antisepsis was maintained. There was a lot of gallery there. I'm sure our main operation theater also had a gallery when it was built in 1925. So I think that was a time when people used to see from above an operation because there were no videos or everything. And look at then came the lights like this. Now, this was where the birth of modern surgery occurred. The first gallbladder surgery was done by Langenbach in 1882. Now, I'm sure Langenbach was a great surgeon, and Langenbach tackled the problem of removing gallbladder in a scientific manner, in a post-mortem room. So, he went to the post-mortem room first. He noted that elephants and horses do not possess this organ, nor rats and pigeons. So, probably he did lot of post-mortems there. And therefore concluded that a man could do it without it, something like appendix. And the operation he devised this was in cadaver experiment. So he took a T-shaped incision and the transverse limb was placed along the inferior margin of the liver and was joined to the longitudinal incision along the lateral margin of the rectus muscle. So he took a very odd incision at that time. Maybe anatomically he thought it was good. And cystic duct was ligated with a silk 1 to 2 centimeter from gallbladder. And this was a 43-year-old man. And I believe, therefore, that I may state that the removal of the gallbladder performed by me for insidious cholelithiasis after preceding ligation of the cystic duct may be regarded as the less dangerous or more effective method, as well as most other disease processes of this organ. I think it was, almost about, say, 140 years ago, he did this surgery with whatever was available at that time. I'm sure the anesthesia was available, antisepsis was available, and he did it with a proper scientific experimentation, and then he did the cholecystectomy. And then you see the different kind of surgery started taking place. And I'm sure Courvoisier, all of us know Courvoisier's law, but Courvoisier also did lot of extensive work into biliary surgery. And he was the one who also invented the famous Courvoisier's law. Simultaneously, you find Theodore Billroth. He started doing gastric surgery. And Theodore means gift of God. The word Theodore means gift of God. Now, he first successfully did a gastrectomy in 43-year-old lady with a malignant obstruction. And the resected specimen of stomach is shown where there's such a obstructed that you can only pass a very small kind of an stick or something like that. And Billroth was the one who then did Billroth 1, Billroth 2, and there was a series of gastrectomies then started and opened up the whole kind of a gastric surgery. Simultaneously, Paul Mikulicz, we all use Paul Mikulicz forceps for the colostomy and all that closure and all. So, initial approach was exteriorization. So, and then the miles, we know abdominoperineal resections. Initially, there was a high mortality, 22 deaths in first 62 cases. In fact, if you look at gastrectomy also, these patients have died within 3 months or 6 months. So initially, surgery has been disastrous in many places. Later, it reduced to 13% and high recurrence rates. And later with the modern anesthesia, now results have improved and now we are in the range of 3 to 4%. So if you really see, the rectal surgery has now completely changed than what it was before. Now you must remember Sir Jonathan Hutchison, because a remarkable clinical observer. He described the stigmata of congenital syphilis and he talked about Hutchison teeth, Hutchison pupils, Hutchison faces. But he was one who also identified a identical twin sisters aged 9 who at the age of the 3 had developed identical black pigmented spots on the lips and inside the mouth, and then they also had some intestinal symptoms. So later this was confirmed by Putz and Jaegers and known as a Putz and Jaeger syndrome after them. But it was the first Hutchison's clinical view which noticed all this. Now then came the world of looking inside the body. And somewhere I think late 80s, I think you find that people started looking at cystoscopy and laparoscopy. So there was a case of urinary retention had been treated by catheterization by ancient Chinese and Egyptians. And also by Indian surgeons like Shushruta and Charaka. They used to put a small tube. And then Freyas and Millins, the father of modern surgery, urology, open surgeries. I think this was a professor of urology in Berlin, Netze, to construct an electrically lighted cystoscope in 1877. And this revolutionized urological diagnosis. And in fact, Young used a cystoscope with a punch attachment to perform a transurethral prostatectomy. So I think if you really see, this was a creativity of surgeons. I mean, many of us think, but these are the people who took risks. They developed these instruments, they went inside and then tried to do something more than what that time world was doing. I'm sure Harvey Cushing's, everybody knows, he had one of the fantastic neurosurgical skills. And an example of Harvey Cushing's arthritic skill, the exposed motor area of the brain in a man with a focal epilepsy secondary to bullet wound in the speech area. So he was so specific about all that. And Cushing realized the vital importance of hemostasis in the dealing with vascular tissues of skull. And he used adrenaline for the scalp. And he was the first to use diathermy at that time in high vascular meningiomas. In fact, if you go to Yale, there are a collection of about 500 to 600 Cushing's brains, which are very well known. And I think they really have now a building and museum about this. And that's the way they have been preserving the Cushing's memories. Simultaneously, if you see, those cesarean sections have been done for many years. I think it was, I mean, if you see even the old pictures, Asclepius have been delivered by his mother, Coronis by Apollo. Now, simultaneously, during that time, Hilton also was there, who talked about tuberculosis of spine and Hilton's abscess drainage. So, Hilton's drainage of abscess, which is very commonly done, is described like this. Now, before the First World War, I think Florence Nightingale.
I'm listening
very
softly. It's about the history of surgery.
Yes.
I deliver lecture.
Okay. Can somebody mute it actually? Okay. So I think Florence Nightingale has tremendous contribution in modern nursing. And she was the one who realized that significantly reduced death rate by improving hygiene, ventilation, quality of care and living standards. And she came to known as a lady with the lamp, making rounds of beds with wounded soldiers and tending to them. And she had a typical humanitarian approach and was a pioneer in statistics and data visualization. In fact, our all wards are known as Nightingale ward. So she established Nightingale School at St. Thomas's Hospital and remained superintendent of school for 27 years. And she is the founder of the nursing profession. And in fact, there are many others in USA also took her work. But this came very vital in the First World War. And if you see the ward dedicated to the fracture of femur in Paris, and there were intestinal injuries, splenic injuries. Similarly, in the Second World War, because of the antisepsis, anesthesia, nursing, and blood transfusions and penicillin, there was a great amount of help and the surgery improved over a period of time. Then came the modern era of Chanley, who started development of prosthesis and carried out Chanley's workshop at his home. And Chanley was a perfectionist. So he also worked on the produce of the first filtered air operation closure. And he went on to the space age suits. And he was the one who started working on Chanley's prosthesis. Simultaneously, you find many times the breast surgery also developed, other all surgeries developed. Like 17th century amputation of the breast was using knife followed by the cautery. That was the way it was very crudely done. In fact, William Halstead's first radical mastectomy, if you see this picture, the patient was submitted to radical mastectomy by William Halstead in 1912. Today, this tumor would have been regarded as technically inoperable. So he introduced the surgical gloves and many other things like hernia surgery, intestinal anastomosis. Now, William Halstead also contributed, though he was very shy, but he contributed as a teaching, and man of his contribution not only left his craft but to the science of medicine in general were fundamental in character, and we still call Halstedian principles, and that is something which is important. Theodor Kocher was a Nobel laureate, and he was from Swiss, and he operated huge goiters. This is a girl who was presented to him, and the child he did after thyroidectomy, mass on the girl on the right, ulcerated through neck. So imagine the kind of patients he operated, and he contributed like Kocher's incision, Kocherization, appendicular incision, and how much of surgeries and Kocher's forceps and reduction of shoulder dislocation. So he was the one who really contributed. Now, it then came the era of organ transplantation. I'm sure Lord Ganesha is a concept of transplant. But I think there were others also who practiced these kind of things, especially in Syria, and they tried to do it. There was a man with a gangrenous leg prayed at the tomb. So he took a miraculous operation. The man's deceased leg was removed, and then he put somebody else's leg who was recently died, was grafted to his stump. Now you see this particular figure where there is one leg has become black. Ultimately they had to amputate, but he was the one who thought about doing a limb transplant. And then came this French surgeon, Alexis Carrel. There was a murder of French president, and Carrel analyzed and he found that portal vein was cut. So he worked on vascular anastomosis. He got needles and sutures, and he developed the triangulation technique, which is shown here, and made many contributions to the vascular suturing. Now, his discovery led to the organ transplantation. And that is the reason why Alexis Carrel, this is a picture with him onto the Time magazine, and this led to the organ transplantation. In fact, there was very nice, everybody knows Valdir Demikhov, 1959, an operation he did. This was a Russian surgeon who transplanted head of a puppy into head of another dog. So you see this puppy who has two heads, and this was a very unique experiment he did. Of course, I mean, these are some things which were done at that time, and they are not replicable now. But plastic surgery began way back with Sushruta, and all of you know that Sushruta contributed immensely into nasal contribution, and he developed this forehead flap rotation, and therefore he also considered to be father of plastic surgery. And then he devised the first nasal flap, and there was also reconstruction of the nose using arm flap. Now this is something which was done somewhere around say 1200 AD, and this was one Baroni's sheep experiment. They started doing, they took one sheep and took out his one skin and they put onto the other side or onto the wound. But if they tried to do it onto the other sheep, it is to fail. So they realized the concepts that it works only in the same kind of a sheep. And then came Christian Bernard, who's world's first heart transplant. I'm sure everybody knows that he did it in 1967. And plastic sheet was used to protect from this particular patient, Louis, from infection. Now, pancreatic surgery started with Alan Whipples, and in 1935, and the first patient died within 30 hours after operation because of the consequences of anastomotic breakdown. But the second and third patients lived for 9 and 24 months. That time this was considered to be a ghastly operation, but now over a period of time, the mortality has come down to 3% or 4%. Then came Thomas Tarzal, who made a tremendous experiment, kind of work, and he started the liver transplant. He is father of modern transplantation. He performed first liver transplant in 1963 when there was no anti-immune drugs. And in fact, his results initially were very bad till the time later on when we got immune, FK506. That was a time in 90s, the results drastically improved, cyclosporine, and that changed the transplant outcomes. The first attempted liver transplant in India was done by Dr. Bhalerao. And I think the first successful liver transplant in KM was done by our team. In fact, if you see the last 1998, Clint Hallam was done this hand transplant. He was a prisoner. He got injury while in prison and he was put this thing. And then after a few years, this was cut because he could not get that anti-immune and he got a lot of immunological reactions. But in KEM, the first hand transplant took place in last year and this was successfully working now with anti-immune drugs. Now, if you look at surgery at KEM, I'll just take briefly, thanks to Dr. Abhay and the Department of Surgery, as well as the Platinum Jubilee thing. I think surgery in KEM started with the great people which Dr. Pandya talked last time about G.V. Deshmukh, A.B. Bacha, Shirvalkar sir, R.N. Cooper, and Baliga sir. And I think over a period of time, urology, neurosurgery started somewhere in 1951. Then urology started in 1955. Pediatric surgery started in 63, 67, 68. That time, plastic surgery started in 61. Somewhere in 60s, I think, cardiac surgery, all these major super specialties started in KEM. And then, somewhere when there was a technology boom, I think in 1980, you signed the general surgery, you signed GI surgery, and the other departments started coming in a big way. You can see the pictures of all people whom we have been working, and we saw them really growing these branches. Now, talking about laparoscopic surgery, which is fairly recent, the first laparoscopic procedure was done in Germany in 1901. And that time he did laparoscopic procedure. Somewhere, as I said, cystoscopy was done in 1877, while this was done in 1901. And same performed the first laparoscopic appendicectomy in 1981, which became the new gold standard. But however, it was never picked up in a big way. And that time also, if you realize, there were a lot of people who worked on to various kinds of scopes, but the technology was not so strong. Till the time Eric Muhe did his first laparoscopic cholecystectomy. And that time there's a story of laparoscopic cholecystectomy where initial lap instruments were in 1972. He created an instrument called as galloscope. I think there's a very interesting story about Eric Muhe. He started working in 1972 and he started being part of the laparoscopy and he was impressed. And then he started doing rectosigmoid polypectomies through pistol grip appliers, through various endoscopic kind of thing. He designed a new operative laparoscope called galloscope. And his initial ports were at the umbilicus and lower abdomen, very low abdomen. That means he was probably having long instruments. And he did 94 cholecystectomies in 1984 to 85, 86. And literally directly he changed his port site to the gallbladder without neoperitoneum because of the costal arch as a firm bony roof. He presented his findings in laparoscopic cholecystectomy before German Surgical Society. The audience was skeptical. They called it as a Mickey Mouse surgery. One of his patients died and Muhe faced charges of manslaughter. But later on, two French surgeons like Philippe Moret and the Dubois, who did in 88, and then you find in 1992, the German Society of Surgery, who initially rejected Muhe's work, awarded him with the top honor of anniversary award. So, I think this is very common that people don't believe surgeons. At the beginning, they are skeptical about it. And over a period of time, when the success is seen, people have always gone through. So, laparoscopic cholecystectomy in India was done by a GS site, Dr. Tempton Udwadia, who performed the first lap cholecystectomy in JJ Hospital. And we did our first national workshop, I think in 1992. Dr. J.B. Agrawal, Dr. Abhay Dalvi and I was there when we conducted the first workshop. And over years, I think, the laparoscopy has now grown and it has now become practically most of the surgeries. We now live in an era where an array of imaging modalities and minimal invasive surgery. We have now modular OTs and integrated OTs. In fact, KEM and MCGM has now such OTs. There are almost more than 15 to 20 OTs and about 100 more OTs are coming in MCGM of these kind of OTs. In fact, there are a lot of new experiments like SILS, that means make a single incision laparoscopic surgery, and endoscopic surgeries which came, but these did not stand along into the surgical field. Robotic surgery is a new innovation that augment the surgeon's eye and hand to achieve optimal views and accuracy during the complex surgery, and in essence overcome the limitations of laparoscopy useful in prostatectomy, pelvic and esophageal surgeries. In fact, this is a new generation robots, Cambridge Medical Robots, where there's a next generation surgical robotic system that is smaller, highly portable robotic arms and more lightweight and flexible. In fact, I have been using this and I find it that this is now going to take over some of the operations definitely.
Meanwhile, these students are performing the same surgery but on an artificial lung. On the left, the real operation. On the right, an organ created by a success. The tumours are
Now, if you see this video, 3D printing and simulations came now in surgery. That means now you can create a replica of the patient with his pathology, where students can learn to operate that by looking at how their boss is operating on a real patient. Now, this is such a great advance for people to learn. In fact, now 3D printing is done even in KEM for some patients. You have to get it from outside. It costs about 25,000 rupees, but people can get this so well that the understanding of surgery is becoming now much better. Now I'm going to take you to the new world, because it's a story of surgery and not history of surgery. So what is coming now? What is mixed reality? The new world is virtual reality, augmented reality and mixed reality. You know, especially
placement. The ureter is closest to the pink zone. The rectum is closest to the red zone. So our green zone in the midline is the one with the greatest safety zone, with both the ureter and rectum at safe distances.
Well done. In what direction would you place the suture?
Now, these are the kind of augmented reality where you create complete replica of the patient's pathology, and then you are trying to understand the anatomy much more better than before. So you can do simulations. So this is coming up. So if you look at augmented reality, has made a lot of change in understanding of patients and improving the results of surgery. In fact, now this is something called as an HoloMedicine, Microsoft HoloLens. And this is called as a Microsoft HoloLens, which is, I think, courtesy Dr. Gao. I was working with him now. And if you see this, the the student is in Singapore, somebody is in Germany, and somebody is in UK. And they are able to see an image, they are able to handle it completely, and they are able to teach and talk to each other. Now, I think this is likely to come because mixed reality is a large virtual 3D images for learning. It's interactive and sharing. Also used for intraoperative surgeries. It's one step ahead. If in fact you look at this, you can do a wonderful preoperative planning. You know this is liver. You can take it in hand. You can rotate it through these lenses. You can know exactly where the vessels are coming. Now those areas of surgery which were not really seen, now you can know exactly the vessels, and everything you can do. You can know exactly what section of liver you are removing. And you can really look at liver from all angles. You can take it with your hands, pinch it, rotate it, and find out what are the relationship, what are the abnormal kind of biliary anatomy which is likely to be there. So if you really see, these are the kind of images which are coming, which are now going to change the surgery. And I personally feel if you can do preoperative planning in a big way, patients can definitely get benefit out of this. In fact, now this is being done at this particular say. Intraoperative image guidance also can be done in this particular way. And if you really see, you can put this and dissect that kind of a liver. Now, I was working with this instrument with this Professor Gawa for last about 6 months, and we are trying to use it for outreach. And I think it has completely changed our training module and the way we can really explain our students. And in fact, if you look at this new paper in Surgery, April 22, it says intraoperative holography navigation. That means you can keep this holography while doing operate. And that 3D printing and 3D image can completely change your surgery. So coming to now close, there are many Nobel laureates in surgery. Theodore Cocker was the one who got in 1909. Though there are not many, of course, the medical and laboratory get much more. Surgeons are not known to get Nobel Prizes, but there are still many people who have got the Nobel laureates. So to sum up, that men do not learn very much from the lessons of the history. This is the most important of all the lessons of history. I think what we should realize that we don't learn from history. I think when I listened to the first lecture on pandemic, I realized that what mistakes we made in 1820, the same mistakes we made in 2020. So I think we should always learn history and use that history. So looking back at the history of surgery provides a perspective on the ingenuity and the sometimes bizarre development of a man to tackle disease. The development of tools, anesthesia, aseptic techniques permanently change the landscape of surgery, while modern advances in technology continue to revolutionize surgical practice worldwide. In study of some apparently new problems, we often make progress by reading work of a great man of the past. And this was nobody else other than the Charles Mayo of the Mayo Clinic. And he always said that whenever you are making a new kind of a progress, try to look at the work of the great men in the past. So what have you learned? Surgery started before its conception. And it was there for many years. Surgery was a barbarian activity. Scientific surgery depends on scientific methods. Evolution in surgery is a continuous process. Till today, we are changing every day. And scope of surgery is tremendous. And of course, hospital, surgery, theater, and books are going to really make a complete change in us. Our surgical landscape is changing at tremendous pace. We are more informed and interconnected than ever with internet and social media. We have more challenges of ethics, communication, dementia, obesity, equity, and others. Tackle these challenges, we need to embrace technology while staying human. And this is what is the end message I would like to give. Thank you so much.
Thank you so much, sir. It was fascinating lecture. It was really interesting to see not just the history of surgery, but also the future of surgery, augmented reality, and
Because you give me a topic story of surgery. If you had given me history, I would have stopped at 1900 or 2010. But I think you have told me to talk about the story of surgery. So I thought I will also talk about the future which is coming.
yes, it was great. It really puts the history into perspective, and you can see the futuristic developments. So I believe we have some comments and questions here. We do have some comments by Dr. Kadambi, who said that technology like augmented reality is a fantastic teaching tool, and what they show in the Netflix miniseries, The Good Doctor, is now in fact a reality. 3D imaging
Yeah,
practice.
I think I have experienced it for last 6 months, and I think it's amazing. We have been talking to people in Nepal, Bhutan, Vietnam, and I think trying to work a case with them is so interesting with this HoloLens. So I think there is a lot to learn how we have understood surgery and how we are trying to improve ourselves.
So there's a question here by Professor Patil, who asks, would you consider the discovery of radiology also made a contribution to the success of surgery?
Of course, I think we cannot underestimate radiology. I think a surgery is always on two aspects. One is the radiology and pathology. I think these two branches where the surgery completely depends. Radiology is one of the most important branch which tells you, therefore I showed you all these images which showed you augmented reality. It's all CT which is put into and then analyzed and done all that. So it's all radiology. But you should also respect pathology, because pathologist also teaches you a lot what is the kind of tumors. So these two branches, if they are strong, then surgeon can grow. You know, in all other with and all these other 5 things, the radiology and pathology are the most important branches for a surgeon. You cannot underestimate their contribution.
So there's one more question from Dr. Bharat Kelkar, sir, who asks if such AI labs are available for ex-GS sites.
Currently, no, but I think they will come over a period of time. Currently, they are in experimental stage. But I think if you look at the literature on AI in last 4 years, I know I was trying to go through, there are about 4,500 publications on AI. And I think I know many people who are working on this AI. I mean, suddenly there is an increase. And if you see every field, AI is coming up. The question is not of having a software, is how are you going to use that in your day-to-day practice? And what is the utility of this? Many times people go on putting images and things. One has to really see how you're going to make the impact of that into the patient care, patient diagnosis, treatment, then intraoperative navigation, and ultimately outcomes. So this is something which we still are working on this. So this is work in progress, but we need to watch it over a period of time.
So there's another question from Sabrinath M, who's asked you if you could say a few words on Trendelenburg.
Trendelenburg, I think I read about him, but he's mainly who contributed on the two things. One is the Trendelenburg's test for the saphenous veins. It was mainly clinical, and also onto the back his Trendelenburg's test for the hip, I think. But I did not get much his contribution in surgery. He may be having, but I could not find it actually. As I told you, there are so many people who probably have contributed. Maybe everybody's name I could not really take it because it is a 45 minutes lecture, right? So I could not get. But what I would advise you, there are wonderful books which are available. I think if somebody wants those books, I can send you PDFs. There are about wonderful books. Harold Illes has written a wonderful book on history of medicine. Then there are so many talks on history of medicine, history of surgery, as well as I think what you have done has maybe whether others how much they learn, but I have enjoyed reading history of surgery. And I think thank you so much for all of you for making me read this history of surgery, because you learn so much by reading and then you realize, yes, there is so much thing you can be done.
So there's one question by Dr. Surendra Mathur sir, who asks, how is it possible to keep tech connected with empathy towards the patient?
I think that's a wonderful question, sir. I think today what has happened, even this mixed reality, what I said, is also now we have been just recently, I had one conference on professionalism in the Himalayan Institute. So I think you have to have that understanding that ultimately the human connect is most important in this world of technology. Technology, you may do it for surgery and all, but the human connection, the feelings, emotions, as well as there are now lot of these technologies also used to see how you can change the the attitude and communications of students. I think there's a lot of work being done. It is still not successful, but communication part, people are working on this. The attitude has to be come with the thoughts and value education. I think we have talked about it very much. I think technology still has not come in that area. But as I said, the last sentence is very important. Embrace the new technology while staying human. I think this is something which is very important. I think one question Dr. Sanjay Nagaral has put is very important question. How women have broke into this male-dominated branch. It's very interesting to see that a lot of men have dominated the surgical world. There are very few women who have made a landmark before, say, 19th century. But there are a lot of women in our country, like, say, Dr. Lata was from Pune, who did esophageal surgery. And now you find that a lot of women has come into most of the surgical branches. And I think in last 20 or 30 years, I have seen a lot of women have come to this. But if you look at history, there is not much of women who are there in this particular world.
So I think we'll take one last question from Gargi Goel ma'am, who asks if there are any examples in history where doctors have become surgeons at a later age, beyond 40 years of age.
I really don't know this answer. See, many times when you go through the literature, they gave only the names of people. Very few have given. There are many inventions people have done at a later part of their life. But I don't know a doctor going into the surgeon. That history is very difficult to pick up from the available literature. So I cannot give you that answer perfectly.
Thank you so much, sir. I think we will conclude this session for today. I would like to remind everyone that next week, that is to say on the 12th of November, we shall be having a lecture on the life and times of Sir William Osler. The lecture will be conducted by Dr. Ravi Ramakanthan sir, and again will be Saturday 6 p.m. on Zoom. We look forward to seeing everyone there. Thank you so much for coming today.
Thank you. Thank you so much. I think I really thank everyone for being there and giving so many comments and questions. Thank you so much. I really appreciate that. Take care.